I need to tell you about something that happened last month that still keeps me awake at night. A 71-year-old man named Thomas came to my office for what he thought was a routine physical. He felt fine, just some tiredness and a few minor complaints he attributed to getting older. When I ran his blood work, I was devastated. His blood sugar was 287 milligrams per deciliter, and his A1C was 9.8%. He had severe, uncontrolled diabetes and had no idea. When I told him, he looked at me shocked and said, "Dr. Richard, I feel normal. How can I have diabetes this bad without knowing?" My name is Dr. Richard, and I've been practicing endocrinology for over 34 years. I'm 67 years old myself, and I've diagnosed thousands of diabetes cases. Here's what terrifies me. Diabetes can progress silently for years, causing catastrophic organ damage, while the symptoms feel exactly like normal aging. People dismiss the warning signs as getting older, being tired, or just part of life after 60. Thomas had been experiencing 5 distinct symptoms for over 3 years, symptoms his body had been using to scream that something was seriously wrong. But he'd rationalized every single one as normal aging. By the time we caught his diabetes, he already had early kidney damage, nerve damage in his feet, and changes in his retinas that threatened his vision. All of this could have been prevented if he'd recognized the symptoms years earlier. Here's the truth that most doctors don't explain clearly enough. After 60, diabetes symptoms are incredibly subtle and easily mistaken for normal aging. You don't necessarily feel obviously sick. You're not collapsing or in severe pain. The symptoms are quiet, gradual changes that feel like what everyone your age experiences. This is exactly what makes diabetes so dangerous after 60. Today, I'm revealing the 5 subtle diabetes symptoms that almost everyone over 60 dismisses as normal aging. These are the early warning signs that appear long before diabetes becomes obvious. When catching it can prevent the devastating complications like blindness, kidney failure, amputations, and heart attacks. These 5 symptoms are based on the latest research and my 3 decades of clinical experience. Pay attention, share this information. These could be the warning signals that save your life or someone you love. Symptom number 5. Unexplained fatigue that worsens throughout the day. Let me start with the symptom that's most universally dismissed as just getting older, when it's actually one of the earliest and clearest signs that your blood sugar is dangerously elevated. Persistent, unexplained fatigue that feels worse in the afternoon and evening, especially after meals, even when you've slept adequately. Here's what's happening in your body. When your blood sugar is chronically elevated, glucose can't get into your cells properly due to insulin resistance. Your cells are literally starving for energy, even though your bloodstream is flooded with glucose. It's like being surrounded by food you can't eat. The energy is there, but your body can't access it. This cellular energy starvation causes profound fatigue that rest doesn't fix. After meals, when blood sugar spikes even higher in someone with diabetes, the fatigue becomes overwhelming. You feel like you need to nap after eating because your body is desperately trying to deal with the glucose overload. I had a patient named Dorothy, 69, who complained that she was exhausted every afternoon, especially after lunch. She'd need to lie down for an hour or two. She thought it was normal aging, or maybe her thyroid. When we tested her blood sugar, her fasting level was 178 milligrams per deciliter, and after meals it was spiking to 240 to 260 milligrams per deciliter. The fatigue wasn't age, it was severe diabetes. Research shows that unexplained fatigue is one of the earliest symptoms of diabetes, often appearing years before diagnosis. The fatigue has specific characteristics that distinguish it from normal aging tiredness. It's persistent. It doesn't go away with adequate sleep or rest. You can sleep 8 to 9 hours and still wake up tired. It worsens after eating, particularly after carbohydrate-heavy meals when blood sugar spikes highest. You might feel relatively okay in the morning after fasting overnight, then feel exhausted 1 to 2 hours after breakfast. The fatigue also has a heavy, sluggish quality. It's not just sleepiness, it's a profound lack of energy, difficulty concentrating, and feeling like your body is moving through mud. Simple tasks feel exhausting. Symptom number 4. Increased urination, especially at night. Now, Let me tell you about a symptom that almost everyone over 60 experiences to some degree, which is exactly why it's so commonly missed as a diabetes warning sign. Needing to urinate more frequently, particularly waking up multiple times during the night to use the bathroom, when this represents a change from your previous pattern. Here's what's happening in your body when blood sugar is elevated. Your kidneys are trying desperately to remove excess glucose from your bloodstream by filtering it into your urine, but glucose pulls water with it through osmotic diuresis. The more glucose your kidneys are eliminating, the more water gets pulled into your urine, creating large volumes that fill your bladder frequently. When your blood sugar is consistently above 180 milligrams per deciliter, the renal threshold where kidneys start spilling glucose into urine, you're essentially peeing out sugar water all day and night. This causes frequent urination that's particularly noticeable at night. Research shows that nocturia, nighttime urination, is one of the most common early diabetes symptoms, yet it's almost universally attributed to other causes: prostate problems in men, weak bladder in women, or just normal aging. The key is recognizing when urination frequency represents a significant change from your previous pattern. If you used to sleep through the night and now wake up 2 to 3 times to urinate, that's a warning sign. If you're suddenly needing to urinate every 1 to 2 hours during the day when you used to go every 3 to 4 hours, that's significant. The urine volume is also important. People with diabetes don't just feel the urge frequently, they're actually producing large volumes each time. You're not just going to the bathroom more often with small amounts. You're producing significant volumes repeatedly. What makes this symptom particularly dangerous is that people develop compensatory behaviors that mask the problem. They stop drinking fluids after 6 p.m. to reduce nighttime urination. They plan activities around bathroom access. They accept frequent urination as their new normal without questioning why it changed. Robert had been limiting his evening fluid intake for over a year, thinking it would help. It didn't, because the problem wasn't fluid intake. It was his kidneys trying to eliminate dangerously high blood sugar. The frequent urination also leads to increased thirst. You're losing so much fluid through excessive urination that your body becomes dehydrated, but people over 60 often have blunted thirst signals, so they don't feel appropriately thirsty despite being significantly dehydrated. Women often attribute increased urination to urinary tract infections and may be treated with multiple antibiotics before anyone checks blood sugar. Men blame their prostate. Both miss the actual cause, diabetes, while the disease progresses unchecked. The nighttime urination disrupts sleep quality, contributing to the fatigue we discussed earlier. You're not getting restorative sleep because you're waking up multiple times nightly. This sleep deprivation worsens insulin resistance, creating a vicious cycle. If you're experiencing significantly increased urination, especially nighttime urination that's disrupted your sleep pattern, don't assume it's your bladder, prostate, or age. Get your blood sugar tested immediately. Symptom number 3: slow healing wounds and frequent infections. Now, I'm going to tell you about a symptom that many people notice but rarely connect to blood sugar problems. Cuts, scrapes, or sores that take weeks to heal when they used to heal in days, or experiencing frequent infections like urinary tract infections, yeast infections, or skin infections that keep recurring. Here's what's happening in your body. Elevated blood sugar impairs your immune system function in multiple ways. High glucose levels reduce the ability of white blood cells to fight bacteria and heal damaged tissue. Your blood vessels also become damaged by high sugar, reducing blood flow to wounds and making it harder for healing nutrients and immune cells to reach injured areas. Additionally, bacteria and fungi thrive in high sugar environments. When your blood sugar is elevated, the glucose in your tissues and body fluids creates the perfect environment for infections to develop and persist. This is why diabetics are prone to recurrent yeast infections, urinary tract infections, and skin infections that non-diabetics rarely experience. I had a patient named Helen, 68, who'd noticed that minor cuts on her hands and legs were taking 3 to 4 weeks to heal completely when they used to heal in a week. She also had 3 urinary tract infections in 6 months, something she'd never experienced before. She attributed the slow healing to thin skin from aging and thought the UTIs were just bad luck. When we tested her blood sugar, her fasting level was 198 milligrams per deciliter. Her immune system had been compromised by undiagnosed diabetes for years. Research shows that impaired wound healing is one of the most specific signs of diabetes, yet people over 60 often dismiss it as normal skin aging. The healing impairment isn't subtle. Wounds that should heal in 5 to 7 days are taking 3 to 4 weeks or longer. The infections also have characteristic patterns. Yeast infections become recurrent, particularly in skin folds, under breasts, or in the groin area. The warm, moist environment combined with high sugar levels creates perfect conditions for fungal overgrowth. Urinary tract infections become more frequent because glucose in the urine feeds bacteria. Women may experience UTIs monthly when they previously went years without one. The infections may also be more difficult to treat, requiring multiple courses of antibiotics. Skin infections develop from minor cuts or scratches that become red, swollen, and infected rather than healing normally. Some people develop boils or abscesses repeatedly. Dental infections and gum disease also worsen because bacteria in the mouth thrive on elevated glucose. What makes this particularly dangerous is that slow healing combined with reduced sensation from diabetic nerve damage can lead to serious complications. A small cut on the foot that doesn't heal properly can become infected, develop into an ulcer, and ultimately require amputation if diabetes goes undiagnosed and untreated. Helen had noticed a cut on her ankle that hadn't fully healed in over a month. She'd been putting antibiotic ointment on it, but it remained red and slightly open. Her elevated blood sugar was preventing proper healing, and the wound was becoming chronically infected. Once we started treating her diabetes and got her blood sugar under control, the wound finally healed within 2 weeks. Some people also notice that bruises take longer to fade or that they bruise more easily. This happens because high blood sugar damages small blood vessels, making them fragile and slow to repair. The immune system impairment from high blood sugar also makes you more susceptible to respiratory infections. You might notice you're catching colds more frequently, or that when you get sick, it takes longer to recover than it used to. If you're experiencing slow wound healing, recurrent infections of any type, or cuts and scrapes that seem to linger for weeks, don't dismiss it as weak immunity from aging. Get your blood sugar tested. These symptoms indicate your immune system is being suppressed by elevated glucose levels. Symptom number 2. Blurred vision that comes and goes. Now let me tell you about a symptom that people almost always attribute to needing new glasses or normal vision changes with age. Blurred vision that fluctuates. Some days your vision is clear, other days it's blurry, or your vision changes throughout the day, particularly after meals. Here's what's happening in your eyes. When blood sugar is elevated, glucose enters the lens of your eye, causing it to swell. This swelling changes the shape of the lens, affecting how it focuses light. As your blood sugar fluctuates up and down throughout the day, the lens swells and contracts, causing your vision to blur and clear unpredictably. This is completely different from normal age-related vision changes, which are gradual and consistent. With diabetes, your vision might be clear in the morning after fasting overnight when blood sugar is lower, then become blurry 1 to 2 hours after a carbohydrate-heavy meal when blood sugar spikes. Research shows that fluctuating vision is often one of the earliest diabetes symptoms, appearing years before diagnosis. Many people get multiple eye exams and new glasses before anyone checks their blood sugar. The vision changes can manifest in several ways. Some people experience overall blurriness that makes reading difficult. Others notice difficulty focusing on objects at different distances. Some see halos around lights or have trouble with night vision. What makes this particularly concerning is that if diabetes goes undiagnosed long enough, the vision problems can become permanent. High blood sugar damages the blood vessels in the retina, causing diabetic retinopathy, one of the leading causes of blindness in adults. The early fluctuating vision is reversible if you catch diabetes and control blood sugar, but retinal damage is often permanent. William had early retinal changes that his optometrist had noted but attributed to age. Once we controlled his blood sugar, his vision stabilized within about 6 weeks. The lens swelling resolved, and he could finally get an accurate glasses prescription. Some people also notice difficulty reading small print that seems to change day to day. You might be able to read comfortably one day, then struggle the next day with the same material. This inconsistency is a hallmark of diabetes-related vision changes versus normal aging. The vision problems are often worse after eating, particularly after high-carbohydrate meals that spike blood sugar dramatically. If you notice your vision becomes blurrier 1 to 2 hours after meals, this is a strong indicator of blood sugar problems. Many people adapt by using reading glasses inconsistently. Sometimes they need them, sometimes they don't, never realizing that the fluctuation itself is the warning sign. They think their eyes are just acting up, or that they need to see the eye doctor again. If you're experiencing vision that fluctuates day to day or throughout the day, especially if it correlates with meals, don't assume you just need new glasses. Get your blood sugar tested first. The vision changes will resolve once blood sugar is controlled, and you'll be able to get an accurate eye exam. This symptom is your eyes literally telling you that your blood sugar is too high. Listen to them. Get tested immediately. Symptom number 1, tingling, numbness, or burning in feet and hands. Here it is. The most important early diabetes symptom that people dismiss as circulation problems, arthritis, or just aging, when it's actually a sign that high blood sugar is damaging your nerves permanently. Tingling, numbness, burning sensations, or pins and needles feelings in your feet, toes, hands, or fingers, particularly at night or when resting. Here's what's happening in your body. Chronically elevated blood sugar causes diabetic neuropathy, direct damage to the nerves throughout your body, particularly the longest nerves that reach your feet and hands. High glucose levels damage the tiny blood vessels that supply oxygen to nerves, and the excess sugar directly injures nerve fibers themselves. I had a patient named Patricia, 74, who complained of burning feet at night that kept her awake. She thought it was poor circulation or restless legs. She'd tried compression socks, elevation, and supplements without relief. When we tested her blood sugar, her fasting level was 223 milligrams per deciliter, and her A1C was 9.1%. She had severe diabetes with significant nerve damage. The burning feet were diabetic neuropathy screaming for attention. The sensations have characteristic patterns. They're often worse at night when you're lying down and not distracted by activity. Many people describe burning feet that make it difficult to fall asleep or that wake them from sleep. The sensations may be symmetrical, affecting both feet or both hands equally. Some people experience numbness rather than pain, which is actually more dangerous because it means you can injure your feet without feeling it. You might step on something sharp, develop a blister, or burn your foot without realizing it because the protective pain sensation is gone. Others feel hypersensitivity. Even light touch from bed sheets or socks causes discomfort. This is called allodynia, where normally non-painful stimuli become painful due to nerve damage. What makes this symptom particularly critical is that nerve damage can become permanent if diabetes isn't diagnosed and treated. Early diabetic neuropathy can improve or stabilize with good blood sugar control, but advanced nerve damage is irreversible. Every day that passes with uncontrolled blood sugar causes more permanent nerve destruction. Patricia had been experiencing these symptoms for over 3 years, progressively worsening. By the time we diagnosed her diabetes, she had significant permanent nerve damage in her feet. We got her blood sugar under control, which stopped the progression, but the damage that had already occurred couldn't be reversed. Some people also experience weakness in their feet or hands, difficulty with fine motor tasks like buttoning shirts, or balance problems because they can't feel their feet properly on the ground. The nerve damage isn't limited to sensory nerves. It can affect autonomic nerves that control digestion, blood pressure, and heart rate, leading to additional symptoms like digestive problems, dizziness when standing, or irregular heartbeat. If you're experiencing any abnormal sensations in your feet or hands, tingling, numbness, burning, sharp pains, or sensitivity changes, don't accept it as poor circulation or aging. Get your blood sugar tested immediately. This symptom means nerve damage is occurring right now. I've revealed the 5 subtle diabetes symptoms that feel like normal aging. Unexplained fatigue that worsens after meals. Increased urination, especially at night. Slow wound healing and frequent infections. Fluctuating blurred vision. Tingling, numbness, or burning in feet and hands. After 60, these symptoms are incredibly easy to dismiss. They develop gradually, they seem like what everyone experiences with age, and they're not immediately debilitating. But they're your body's desperate warnings that high blood sugar is damaging your organs right now. If you're experiencing even one of these symptoms, get your blood sugar tested, fasting glucose and A1C. Don't wait for your next routine physical. Don't assume it's just age. These symptoms indicate diabetes is present and causing damage. Early diagnosis changes everything. Diabetes caught early can be managed, reversed in some cases, and controlled to prevent devastating complications like blindness, kidney failure, amputations, and heart attacks. Don't ignore these warning signs. Your body is telling you something is seriously wrong. Listen to it. Get tested today. Early detection could save your vision, your kidneys, your nerves, your heart, and your life. These 5 symptoms are not normal aging. They're diabetes announcing itself quietly before it destroys your health permanently. Act now.